Hi, everybody. I am so thrilled to share that we have Katherine Parker with us here today. Katherine Parker is a child life specialist, and her talk is titled Child-Centered Considerations for Conversations About Cancer. So the description is this presentation will review recommendations for how to initiate conversations with children ages 3 to 20 about cancer diagnoses, treatments, and changes in prognosis. It also highlights developmentally appropriate resources, books, handouts, videos, etc., to enhance ongoing dialogue and understanding. Katherine Parker is a creative arts therapy coordinator and supervisor in the Child Life and Creative Arts Therapy Department at Mount Sinai Hospital. She specializes in child development, medical psychotherapy, psychoeducation, and traumatic grief. When she is not at Mount Sinai, Katherine is an adjunct professor at NYU teaching graduate art therapy students about medical art therapy and clinical internship skills. Katherine, thank you so much. Alyssa, I'm happy to see you here today. And I'm going to just turn the floor to you.
Absolutely. Thank you so much. And just one clarification, this happens a lot. I'm actually not a child life specialist. I work in the child life department, so I get overlapped with them quite often. But by training, I'm an art therapist. I'm a licensed creative arts therapist in New York State. So I'll talk a little more about that in my role too, but it happens a
Sorry about
lot because
that.
no worries. I'm part of the child life department, so it's good to clarify. So let me just share my screen so I can share a little bit about our topic today. Okay. Well, welcome. I know we have a small-ish group today, but I do hope to hear from some of you. What if you have any specific, thoughts or questions or concerns related to different age groups? We are going to dive into a little bit of detail, but I'd love to try to tailor it to some of the things that are coming up for whoever's on the call, if that's helpful. But really, I'll be giving a general overview of myself, my role, how we initiate conversations with children about cancer, and then we'll get into some of the details related to development and how to support them. So just a quick overview of my role here at Mount Sinai. My title here is a family care coordinator. Again, I am a licensed creative arts therapist in New York State. I specialize in art therapy, and I do collaborate very closely with child life specialists in our child life and creative arts therapy department. Initially, when this role was formed, it was held by a child life specialist. Jillian, I do think you met Stephanie Tower, was in the role before me. I think she might have presented for Women to Women early on when she first started. She was a child life specialist, so this role has changed a little bit. But really, the focus of this role is to provide support for caregivers who have children in their life. Most of the families I work with, it is, a parent-child relationship, but I also work with grandchildren, nieces, nephews. I've consulted sometimes even with teachers who work at schools with young kids and want to prepare them for how their physical appearance might change over time. So I really help with guidance on how to start conversations, specific language to use, recommendations for how to set up the conversation, which we'll talk about today. I do also rely on a lot of resources, books, videos, toys, play, things like that. A lot of things to really make this conversation more approachable and more child-friendly. When we approach things with curiosity, with play, kind of getting on the level of the child that we're working with, um, it makes things a little less scary. It's still hard to have these conversations, but it relieves a lot of the anxiety and makes things a lot more approachable for children. I do a lot of my work outpatient, but I do also work with families during inpatient admissions, whether it's for an ongoing treatment or for a specific surgery, and how to help prepare the children for the hospital admission, whether it's just preparing for the separation and how to support them being separate, or if the children want to visit the hospital, how to make sure they're prepared for what they might see, what they might experience, so that again, it's a little less scary. And then in an ongoing way, I do provide art therapy support for children and teens. Currently, most of the support I do is on Zoom because I do work system-wide. So I again work a lot of outpatient. So I'll connect with families and then connect with their children or teens over Zoom to provide ongoing art therapy for support. And then I also work on some memory making and milestones for some of the more chronic or terminal cancers. So really the reason why my role came about and the main goal for it is because we know that the medical experience itself is a major family stressor. Child life specialists and my role in my department really originated in the pediatric hospital in how to support pediatric patients when they are experiencing the medical setting themselves. But as we started to expand our reach and hear from other teams throughout the hospital, we realized that it's just as important for when the parent or grandparent or sibling or someone in the family is impacted by a medical condition, that it in fact it impacts the children and teens as well. The relationships change, routines change. We'll talk a little bit more again developmentally about how each age group is impacted by the medical experience, but we like to look at it really holistically and how we can support the entire family through this process. So I first want to start with some tips for initiating the conversation. This is usually the hardest part where even if, a parent or guardian feels really good about what they want to say, how they want to have the conversation, they're not really sure what the first step is. How do we sit down? I've had parents that I've consulted with be like, what do I do? Do I just sit down and say, I want to talk about cancer? And the honest answer is yes, that's kind of how you do it. You have the language, you have the plan in place, and then you sit down and do it. The hardest part is often the anxiety leading up to it. So a lot of my role is trying to help mitigate some of that anxiety by creating a plan. So the first thing I like to emphasize is honesty. Depending on the age will depend on what and how you share the information. But I always like to say that whatever is said to a child should be the complete truth. It should be honest. But that doesn't mean you have to share everything with them all at once, which I'll explain a little more as we get into the age groups. But I really try to encourage parents or guardians or caregivers to not lie, to not try to make up something, even if it's well intended, even if we think that it will be better in the moment or it will kind of ease the blow. The reason we encourage not to do that is because it really breaks the trust. So even if you come back later with the truth and try to explain it, even if you again are well intended, a lot of times it's very confusing for children. It can be really hard to repair the trust that's broken in that way. And so again, we'll go over kind of each age group and how the honesty comes into play. But I always encourage honesty. Um, and then for the initial conversation to really set the tone. So if you're ready to have the conversation, making sure they know that's an important conversation. So this shouldn't be a conversation that's happening like in the car on the way to school or they're about to go to a sleepover. This is like well planned out, maybe sitting down after dinner or on a Sunday morning and letting them know we're going to sit down and have a serious conversation. There's something really important that we need to talk about. And then within that, allowing the space and time. So again, all the information doesn't have to come all at once. It can come in pieces, especially for younger children. A lot of times it's really just an initial labeling of what's happening. And then they run off and play. And I'll describe kind of what that can look like for some people. And then letting it sink in, giving them some time to process and going on from there. For most children and teens, one of the biggest things that can be really helpful is consistency. Um, a diagnosis of any kind, but especially cancer where it's ongoing. There's different levels of treatment, different types of treatment, different involvements of different teens. So many things can feel really out of control, whether it's who picks them up from school or who's making dinner or what their parent looks like or the energy or the emotions in the house. So really preparing as much as possible in advance for what the changes might be. And again, this doesn't mean you're throwing everything at them at once. You're not giving them everything that could possibly go wrong. A lot of times the conversation is just acknowledging that things will change. So you don't have to share what may or may not change. You could just say, things are going to change over time. I'll update you as they change. If you notice anything that seems different or you want to talk about it, let's talk about it. So it's really just acknowledging that things will change because, again, as well intended as it can be to try to pretend like nothing's wrong and everything's the same, it can be really confusing for a child when their parent is acting and saying that everything's the same and nothing's different, and yet they're noticing a lot of things that are different. Again, whether it's the emotions or the physical changes or the routine. Kids are so perceptive. They can definitely see those things. So just acknowledging it can really go a long way. And wherever possible to provide choices. So again, if they're used to a certain caregiver picking them up from school, and now that caregiver is no longer able to because they have a doctor's appointment, if you're able to give them a choice, do you want grandma to pick you up or do you want your aunt to pick you up? So where can there be a little bit of flexibility? Or even if it's a choice for dinner, if normally someone who makes dinner is now feeling too tired to make dinner, giving them a little choice in either what's for dinner or how they want to have dinner as much as possible. And then finally, we will talk about this a little bit more towards the end with expression in making sure they have the space to process what's happening. So naming how they think and feel. And the best way to do that is for us to model it, for you to model it. So again, not trying to pretend like everything is okay. Even if things are going well and you feel good, it's still, you're allowed to feel more than one thing at once. So it's really important to be able to label that, if they have to miss a birthday party or they can't go to a sleepover, some things that are really important to kids, to label that, to say, yeah, I'm also really sad that you have to miss that sleepover. And in the same either sentence or situation, how to incorporate coping skills. So, yeah, sometimes I do feel really worried, but I feel so much better when you hold my hand. Or, I feel sad that we had to miss that event, but I'm so glad that we got to cuddle on the couch. It makes me feel so much better when we can sit and talk to each other. So you're acknowledging that it's okay to have big feelings and it's okay to have feelings that are new and different. And there are ways that we can manage them. So I wanted to highlight these common questions. We see this a lot, really, for all kids of every age. And how these questions are answered will really depend on the individual child. So it'll depend on their age, their developmental level, it'll depend on their personality. And this is where I really value partnering directly with the families, with the caregivers, to have these direct conversations. So is the child someone who benefits from a lot of information? Are they really curious and they like to know more information? Will that be helpful for them? Or do they tend to be a little bit more anxious and kind of perseverative and kind of limiting information for them could be helpful for them? So it really depends on the specific child, but I like to share these questions because it can help shape what that initial conversation looks like and then also ongoing conversations. Because whether or not the child asks these questions out loud, it's very possible that they're thinking about them. And so whether you provide them information up front to go ahead and address these questions. Or if you just have them in the back of your mind so that when they're ready to ask the questions, you know how to answer it. And this again is where the honesty and consistency comes in. So what is it called? We always recommend to use the word cancer. This can be really challenging for some people. for a lot of different reasons. But I think the biggest reason is that because as adults with life experience, the word cancer comes with a lot of other things. We associate it with a lot of, anxiety, fear, worry, anger, guilt. A lot of these things are tied to this word. Where for children, oftentimes it's a brand new word. They may have never heard the word before. And this is one example I hear all the time, especially for really young kids, before age like 6 or 7, where most of the time they've never heard this word before. I've had a lot of parents come to me and say, well, we sat down, I told them that I have cancer, and they said, okay, and got up and ran away and went to play because they don't know really what that means. And for them, the worry and the concern is not actually in the word. It's not actually in talking about the medical experience. It's again in all the changes that are happening. So giving them something to kind of give them an answer to explain why all these changes are happening is really grounding for them, that they know that it's caused by something specific, and it's not just something that could happen at any time to anyone. So using the word cancer is really helpful. And then depending on, again, the age, the child, what's helpful for them, there's a spectrum of how detailed. Some children really like to know the specific name, where in the body it happens. You know, what the different treatments are. And this helps answer all these other questions. So knowing where it happens in the body, you can be a little more specific about what causes it. A lot of kids will associate cancer with other sicknesses. So thinking that, they went to a sleepover, their friend had a cold, and then they came home and now their parent has cancer and they think that they caused it. So by being specific, giving it a name, calling it cancer, and then explaining where it comes from. It's something that happens in the cells. Most of the time, we don't know what causes it. It's something that happens in the cells. It's not something that you can catch from a germ, that you can get from stress. You can't get it from not eating your vegetables. Like you can kind of be creative in, again, how your child might think about illness and things like that to be really specific. But it's really important to clarify what it's called, where it comes from. It can't be caught. And then a lot of kids also want to try to help cure it, like, oh, I'll get you medicine, or oh, if I do my homework, we'll talk a little bit more about magical thinking in a minute. Um, but by being really specific about what it is, you can answer a lot of these questions. And then the final question, who will take care of me? Again, this kind of comes on a spectrum depending on the child and what they're concerned about. But this could be as simple as who's going to pick me up from school, who's going to make dinner, who's going to tuck me into bed at night. But a lot of times children, really starting around, I've seen even as young as age 3, um, have a curiosity about life in general, but especially when there's a medical diagnosis or a hospital involved, one of the first questions kids think about is death. And regardless of the diagnosis, even if the prognosis is really good, that's not something that's even on the table. That's what kids are thinking about. They hear it in the news, a pet dies, it's a curiosity about life. And so again, the spectrum can range from who's going to pick me up at school to if you die, where am I going to live? I've heard a lot of kids express anxiety about like going into foster care when that's not even on the table. That's not even an option for most kids. That's where their mind goes. So if it's not something that's explicitly talked about, they're going to kind of spiral into all of these anxious thoughts. So if it's a question that comes up, being prepared for what the answer is. And even if it's not a very specific answer, it could be as simple as, that's a great question. There are a lot of people who love and want to take care of you, and we can make a plan together to make sure that you feel well cared for. And the same goes for the smaller questions as well. So let's take a quick look at some of the specific age groups. Again, I try not to go into too much detail here because every child themselves is unique and has their own personality, has their own learning style. A lot of what I'll share today is also based on neurotypical development. So thinking about kind of standard milestones that children reach. And so, of course, there are also other considerations for children who may have autism or ADHD or other learning styles, which is why it's so important to really partner and tailor conversations specific to each child. Um, but focusing here on the sort of like preschool ages 3 to 5, this is again where really the main concern of the child or the main interest is not actually the cancer or the medical experience, because most of the time they've never heard that word. They may have never really been to the hospital outside of maybe getting their shots or a checkup. And so they don't really know what questions to ask because it's something brand new to them. Um, this is an example that I shared that I always see when a parent will label it cancer and the kid says, okay, and then starts playing because they've got what they needed. They're like, what's going on? They explain what it is, and that's enough for them. Really, what the major sensitivities here are the changes. So, physical changes, if a parent is going through like chemotherapy or radiation, hair loss, weight loss, changes in appetite, changes in energy, changes in skin color, bruises, pain. If there's any types of surgeries where caregivers have to refrain from lifting things or playing too much. So these are the things that it's really helpful to prepare a child for. And at this age, again, it's not so much explaining why, going into detail about the surgery, or explaining any details about the treatment. It's really preparing them for the changes. So, for the next 6 weeks, mommy's not going to be able to pick you up. But here are some things she can do instead, and offering other things. You can sit on the couch and read. You can hold her hand. You can listen to music together. So offering other options if things have to change. Some of the most common things that happen in this age group are, of course, separation anxiety, especially if the routine is out of sync. If a child is used to a certain person picking them up every day, and they don't get to see them as often. Even if they see them later that day, we still see some separation anxiety related to that. But especially if a parent or a significant caregiver is admitted to the hospital for a significant amount of time. We also see a little bit of regression here with eating, sleeping, toilet habits, general hygiene. A lot of it, again, is related to the separation anxiety of like wanting to be cared for or wanting someone to care for them. We do see a little bit of short bursts of emotion. So whether it's irritability, stubbornness, temper tantrums, honestly, this is quite typical for this age group in general. They're starting to learn emotional regulation. What is this thing that I'm feeling? I don't know how to express it, so I'm going to use my body or my words to get it out. So it's quite typical in development anyway, but especially when there are a lot of changes happening, we can see this. And this also comes out physically. So stomach aches, headaches, not eating or eating too much, things like that. And then finally, one thing that I'll hear caregivers share that feels concerning to them, but it's actually a really good thing, is when children play and act out themes of doctors or hospitals or treatment, things like that, because this is how kids learn. So just like if, a child first learns about dinosaurs, they're going to spend the next 3 weeks playing and talking about dinosaurs. And this is how they learn. They play, they explore, they show some curiosity. I'm so sorry. I'm just now seeing some comments in the notes. Oh, thank you guys so much for sharing. Yes, absolutely. Yeah, that's like a good age, 4, 5, 7, to start having these conversations. And I wish we could have, yeah, we could have met when you were first diagnosed. Oh, and then Alyssa sharing about how she's stressed about telling him. Exactly. I do. A lot of the anxiety comes from like leading up to when you're going to tell them, even if you have everything ready. Um, Yep. He said, Mommy, I love you. I'm hungry. Can I have a fig bar? Thanks, Alyssa, for sharing. Absolutely. Yeah, those are great examples. So moving into a bit of the school age, at this age, this is also where, again, they're still pretty into changes will affect them, but they start to have a better understanding of illness. And this is where it gets extremely important to use specific language and honest words, because for them, when they hear the word sick or they hear the word ill or they hear the word doctor, they're going to think about what they know, which is probably a cold or the sniffles or sneezing or coughing or the flu or getting a shot at the hospital. And so if they hear the word sick or they see someone going to the hospital and they're associating it with what they know, then they're going to think that this is going to happen to everybody. So they're going to think that if they get a cold or if their friend gets a cold, then they have to go to the hospital and then they have to go get treatment every week. And so they start to make these connections in their brains, which is a lot scarier than what's actually happening. So by giving them a word, either the word cancer or even being specific with what type of cancer, it helps differentiate. And it helps them understand that there's a difference between a cold and cancer, because a cold is something that you can catch. A cold is something that everyone can and probably will get. Whereas cancer is something very different. It shows up in a different way, it's treated in a different way, and it helps really guide that conversation. This is also where we first start to see this magical thinking, which I mentioned before. I'm curious if anyone's ever heard of magical thinking or if uh, anyone knows what I'm talking about when I say that. I gave kind of an example earlier. So magical thinking is very magical, but oftentimes in the psychoeducation field, it's something that can be harmful for kids because what they're doing is they're using their amazing magical skill of imagination. They're partnering it with logic and what they know about the world, and they're creating stories that most of the time are not true, and almost all of the time cause a lot of fear and anxiety because they're creating a story based on their circumstance. So I'll give you an example. One girl that was working with a few years ago, she was 9 when her mom was diagnosed with lung cancer. And at home, she started seeing changes in her mom. Her mom had to use oxygen. Her mom was coughing a lot. It got to the point where she had to stay in bed quite a bit. And then she would cough so much that sometimes she would throw up. And this is what this girl was seeing. And so when I first met her and I asked her, I always like to kind of do a level setting of like, tell me what you know. What is it called? Where does it come from? And she knew it was called cancer. She said, my mom has lung cancer. I said, where do you think people get lung cancer? Where does it come from? And then she told me full confidence, like she was giving a report at school. She said, oh, I know the answer to that. Lung cancer happens when you ride the bus and you catch a germ and you breathe it in and you breathe in the germ from the bus and it gets stuck in your lungs. And the only way to get it out is you have to cough a lot and you have to cough and cough and cough until you throw up. And that's the only way to get rid of the lung cancer. And in my head, I'm like, wow, this is like kind of a beautiful logical story where she took what she knows about her life. She used to ride the bus with her mom every day. Now she's seeing these symptoms in her mom, and she's created this story about how someone gets and cures lung cancer. And at the same time, it was causing immense anxiety for her. She didn't want to ride the bus anymore because she was afraid she was going to catch lung cancer. She didn't want to go to school or see her friends. And so this was a great opportunity for us to kind of step back, clear up the misconceptions, and really help her understand where it comes from, what causes it and how to cure it. And because this huge story that she had created was causing so much anxiety for her. So that's a great example of how kids use their logic and magical thinking. And a great example of how when we withhold information or we think it's helpful to not share information with children, that they're going to fill in the gaps with their imagination. And most of the time, it's much worse than the actual reality. So sharing as much as we can and being as specific and detailed as we can actually alleviate a lot of that anxiety that they're feeling. Because this is also the age where kids are prone to anxiety. Maybe they're starting school, they're starting to make new friends. So a lot of things are new for them regardless. And so adding in another layer of something that's new, something that's they have to learn about or to navigate as a family can increase that anxiety. So most of the time for this age group, and I say most of the time because again, every child is different. Some are more prone to anxiety and benefit from other things, but most of the time, having more information is helpful for them. Not only the language and the words to describe it, but oftentimes they'll also be really curious about the physical changes. So if someone has a surgery or someone has a port for chemo, they want to see it. They're like, I want to see the scar, I want to see the port. And most of the time, I recommend to let that happen. To, of course, do it in a way that's safe, both for the caregiver and also for the child. Because if they don't see it, they're going to picture it in their heads and they're going to use their imagination, something they might have seen on TV or in a book. And in their imagination, it probably looks a lot much worse than it is. Where a lot of times, a port or a surgery scar, it's usually not really as bad as people build it up in their heads. Of course, for the caregiver, it's usually quite painful and hard to manage. But that also helps with the conversation about changes. So if you can't pick someone up anymore, or they can't sit on your lap, if they see why, if they see the scar, they see the bruising, they see the discoloration. It helps them kind of connect the dots there. And then a lot of kids this age, I mean, again, in general, pretty typical is that it's not fair. Why does my mom have cancer and my friends don't? Why is this happening to us? And really the only there's not really a solution for this, but really the only recommendation is to just say, you're right. Absolutely. It's not fair. Um, and then this age too, very similar to the younger age, where they can very easily toggle between feeling upset to stressed, and then 1 second later, they're outside playing or their favorite TV show is on. This is again part of the just the development of the brain and how to process information, how to self-regulate. It's actually a really good thing. The smarter the child, the more imagination. Absolutely. That's so true. All right, so as we get a little bit older, a lot of the same things apply for this group, except that they do have a little bit more understanding. So this is an age group where I do recommend sharing more details, whether, again, it's pictures or seeing things in person, visiting the hospital, visiting the chemo suite, wanting to meet the doctors. I've had quite a few kids in this age, like really curious about, like, I want to meet the doctors who are treating my mom to make sure they're doing a good job. A lot of times their behaviors are a little more amplified. Sometimes the shift from anxiety to anger. So a little bit of that unfairness, just kind of feeling angry. I've had quite a few kids in this age group have a little bit of increase. I wouldn't say issues at school, but definitely a lot more sensitivity at school. I think in general, this age group, there's a lot of, like teasing, joking. I had one boy that I was working with who was often sent to the guidance counselor, and we finally got at the core of it, and it was because his mom was sick with cancer, and a lot of his friends would make the like your mama jokes, and every time they made a your mama joke, he just thought of his mom and just would get so upset, and didn't know how to talk about it or express it. So he would push people or punch the wall, like it would come out in a lot of anger. And then once we finally got to the core of it, we could find a solution and work on coping skills for it. But a lot of things that happen, sort of in the normal social circle of this age, can really amplify when a child is dealing with a significant change. Um, yeah, a lot of the same other things as well. And then finally, as we get into teenagers, this is where it really starts. They're really able to comprehend and process, really specific things. So, if it's a very specific genetic mutation of a cancer, they want to know about it, how chemotherapy works, how radiation works. They want to know the details. I forgot to mention for the age group before, as well as this group, one thing that's also really helpful is awareness of like a schedule. I've heard a lot of kids find it really helpful to have like a calendar on the fridge so they know exactly when the chemotherapy is happening, when the surgery is happening. Sometimes it's just the comfort of knowing when things are happening, of being included in the process. And other times it's helpful because they know, on the day that mom has chemo, the next few days she's going to be a little bit tired, so we'll be a little bit more sensitive to how we support her and interact with her. And they really want to help. They want to be, aware of those things so that they could help. Um, in this age group, also really thinking about the future. So wanting to think about like finances and preparing for college and getting a job. One of the things I recommend most with this age group is trying to find a balance of giving them a way that they can help and feel useful and feel supportive, but still letting them be teenagers, like finding a way that they can still hang out with their friends. They can go to soccer practice. They don't have to take on so many responsibilities to a detriment of them. And at the same time, helping is helpful for them. So finding a good balance of that can be really helpful. And really, I think with all ages, again, this sort of contemplation of life and death, at really young ages, it's sort of theoretical and it's kind of mystical and it's something that they're really exploring. Whereas teenagers either have experienced it before or they see TV shows or they read books and they have a little bit more concrete understanding of it. So it's a little bit more prevalent on their mind. So just some general tips. Again, really not trying to be too prescriptive because every child is pretty different. But for the younger kids, if especially there's some separation anxiety or wanting to be closer to the caregiver, ways they can feel connected, drawing pictures, making a card. I've had actually really in the next age group, ages 6 to 11, I've had families have like a family journal where they'll like write notes to each other in a journal and then like leave it hidden throughout the house. So it's kind of a game, and then you can find a secret note and kind of share information that way. Well, really for all ages, but especially for ages 3 to 5, books are really helpful. Images, rhyming words, something a little bit more, a way for them to connect to the information, to connect to feelings in a way that's not so direct because they still don't really know about feelings about themselves. So to learn about it in a way that's through a story can be really helpful. For school age, correcting misunderstandings. So again, if they share something with you that's very wildly inaccurate, to make sure that you're correcting the inaccuracies in a developmentally appropriate way, in a very honest way, acknowledging the unfairness and disappointment of it. And then as we get into teenagers, including them in discussions about practical things. I've heard a lot of teens like want to put off college or to get a job. So have a concrete conversation about why, how the family is being supported and why they can focus on their role as a teen, which is to have fun and to learn and to prepare for the future. And then, of course, for all, very honest, concrete language, sticking to things as consistently as possible. For most of the things that I mentioned for all the age groups, we consider fairly normal. We do expect a change in behavior because there's a change in situation. And so I really try to encourage people not to panic if they see some of these changes because it's going to happen. What I do do say is if some of the symptoms are ongoing, if it's lasting for more than a month or kind of into 3 or 4 months, or if it really starts to impair their daily living. So if it's impacting them at school or with friends or with things that they used to enjoy, or events they used to go to, and these things are changing. And then especially for older kids, if they're starting to engage in risky behaviors, or having behavioral outbursts, then that's a good sign to consult a therapist. A lot of schools have either guidance counselors or psychologists built into their schools, which can be a really great place because that's where they spend most of their time. So they can have an eye to see if any changes are happening, and they have a place to go if anything comes up throughout the day. So I just sort of give a caveat to keep an eye on it, to let things settle and to give children time to process, but not to panic if their behaviors change for a few weeks. And then I just wanted to end with kind of some thoughts on some resources, and all of these I will be more than happy to share with you. I can make sure Jillian gets them to you, because not all of these are helpful for everyone, so I'm not going to spend too much time going into details, but I'll just give you a quick look. Of course, we have at Mount Sinai, we have a family care coordinator. Other hospitals have either a child life specialist or a similar role to help support these conversations. And also a lot of social workers, at least here at Mount Sinai, have done a lot of in-services in helping train social workers with child-centered language and resources. So if you're not able to connect with me directly, your social worker can help support these too. I have also started working on some tools for knowledge and preparation. So giving kids the information that they need and crave so that they don't have anxiety. So this first one is what happens during chemotherapy. So really trying to be as concrete as possible about how does it work? What does it look like? What's entailed? So again, this can be tailored to each specific person and what their experience is, but I found images are really helpful, whether it's graphics like this or actual pictures of what's going on, or a visit to the actual suite. Where does someone go? Sometimes they're in the hospital, sometimes it's outpatient. What are the side effects? Starting to help prepare them. And this I often will go through with the caregiver first to kind of tailor it as specifically as possible to make sure that they feel comfortable with everything. And then either I'll go over it with the child or the parent will go over, or we'll do it all together. So it really depends. I also created one for mastectomy. I work with a lot of breast cancer patients. And this is something that is hard for parents for moms to talk about because there's so much going on for themselves. There's a lot tied into it. With all of the changes that are happening. And so giving them something really concrete to rely on. So what's going to happen, where it happens, kind of what to expect here. This I included after, again, a kind of story of magical thinking. I smile when I think about it because it's just kind of very endearing the way that children's brains work. But I also know how much anxiety it causes. I think she was 10 years old. Her mom was getting a breast reconstruction, and she came into one of our sessions like very tearful. And I finally got her to open up, and she said, well, I'm just so sad that after my mom gets her new breast, I can never hug her again. And I was like, what do you mean? Tell me where that's coming from. She said, yeah, well, once she gets the balloons in her chest, if I hug her, the balloons will pop. And so in her head, she thought that they were putting actual balloons, and that how easily balloons pop. This is the story that she created. So we kind of took a step back, we took a couple of breaths, and then we talked about what they're actually made out of, that they're really strong, what goes in them, that it's not air, that it's saline, and we got into the details, and she felt so much relief. So again, another example of how creative kids get with their thoughts, but that cause so much anxiety and distress for them. This is one of my favorite groups. I refer families to this often. Unfortunately, I've not been able to develop any group programming in the work that I do, but it's so helpful for kids to meet other kids who are in similar situations. So this is very specific to children who have a parent or guardian with cancer, so not nieces or grandchildren. Actually, they might have a little flexibility there. You can always reach out. But they do like a 5-week curriculum. So it's about kind of what we're talking about today. What is cancer? How are they impacted? They do activities together. They share their stories. And I found it's just really helpful for kids to not feel so isolated. And that's also a thing I hear a lot from children, especially around the unfairness of like, none of my friends at school are going through this. It's so unfair. So to be able to connect with others really takes out some of that isolation. This is also another organization that I like that has a lot of great resources. So I have this shared drive with some handouts. So this is one on like how to talk about cancer, a lot of what we've talked about, like be truthful, keep it simple. I have some for looking at coping, again, very similar to how we talked about what to look for, when to be concerned. If they're planning to visit the hospital, some tips to go into, how to prepare them, thinking about routines, very similar to what we've talked about today. So again, I can make sure you have access to all of these. And then finally, books. I love books. I use them in consults. I use them in ongoing art therapy. I do a lot of bibliotherapy. I do have two PDFs that I'm happy to share. One is a little more for like toddler and like preschool, maybe early school age. But I really love this because of the visuals that explain where cancer comes from. So how it's like cells in the body. They're kind of like Legos. They make up who we are. Cells are usually good for us, but then sometimes cancer cells show up. And so it helps kind of clarify that cancer doesn't come from a germ. It doesn't come from an outside source that happens inside the body. So this is a great one for that. And then something similar, but for teenagers. And this gives a little bit more of that, if they're looking for some autonomy and independence where they can work through it by themselves, they can work through it with a therapist or a parent. It gives some really concrete information about the medical setting. So gives a little bit more control to the teenager. And then finally, some kind of there are a few teenage focused books. This one in the corner here, My Parent Has Cancer and It Really Sucks, is for teens. The Year My Mother Was Bald is for teens, but most of them I would say are for toddlers and school age that have really good visuals, really intriguing storylines. This one on the left here, My Mommy Has Cancer. That actually is specific to breast. Oh, it's on both sides. I was going to say it's a breast cancer book. Was actually written by the boy who wrote it. I think he was 9 or 10 when he wrote it about his mom's experience with breast cancer. So again, it's really good for kids to hear from the perspective of other kids. And then, of course, books for feelings. These I highly encourage, even if you're in your survivorship phase and you don't have to talk about cancer anymore. It's always great to talk about feelings, really for any age group, but these range up to like school age. There's some good ones here. And I'm happy to pass these along for you as well. But we have like 10 or so minutes left. I wanted to pause here, see if anyone had anything else they'd like to share. We heard from a few of you in the chat, or if there are any specific questions that I can go back to touch on, for anyone who's here. I'd love to hear from you now.
Catherine, I just also want to say that that's incredible. So
Oh,
thank
yeah,
you so much. I just learned so many different resources. So
great.
huge. Thank you. Elisa,
And
go
I'll
ahead.
pass them on. I'll make sure they're shareable for everyone.
Thank you.
Alyssa, I saw your hand. Yeah.
Hi, thank you so much. I feel like this is like written for me and could have been
Wow.
written by me because like exactly what you said was what was happening.
Wow.
I got diagnosed right when my son was 4.5, And the conversation went exactly how you said it would. He gave me a hug. I love you very much. I want a fig bar. I'm going to play. And I was like, for
Yep.
3.5 weeks, like, today you're going to tell him. No, you didn't tell him. Today you're gonna, and it was
Hmm.
awful. But right now, actually, um, I'm having a surgery on Monday because I had, like what you said, I had a double mastectomy last February, and then one of the implants failed. So I've had one boob for the last almost year, and it sucks.
Yeah.
They wanted to do the surgery in October, and I wasn't ready, and my kid was having a hard time at school, so I put it off. But but then they had a cancellation in the schedule and insurance had already approved it. So I went for my consult last Thursday and they were like, when do you want to do it? And I said, as soon as possible. And then they said, well, what about February 2nd? And I thought that was like 2 weeks away.
Wow.
And it was really next Monday. And I'm like,
Yeah.
well, guess we're committed now because the insurance approval expires on the 6th of February
Oh,
anyway.
wow.
So
Hmm.
and I'm also a very anxious person. So I'm like, well,
Hmm.
if I know I'm going to have it March 4th, then I'll just be that nervous until March
Right.
4th. So, but how do I? My son is totally regressing
Hmm.
in school and at home, and he like refuses to be alone anywhere in the house. And it's like,
Hmm.
this was happening even before he knew this surgery was coming up. So I don't really
Hmm.
know exactly what's going on. He's been diagnosed with ADHD within the
Okay.
last 4 or 5 months, and he's tried well, he tried Concerta, and now he's on a stronger dose of Concerta. He needs drugs to fall asleep, and he now
Mm.
needs drugs to keep his appetite going. It's just a big mess, and I don't
Yeah.
know how to
How
handle
old is
it.
he now? He's
He's going to be 10 March
okay.
24th.
Okay. Yeah, I mean, emotions are tough for 10-year-olds anyway, especially when there's a lot going on. I would recommend trying to find a way to like create that connection with him, even if it's something small throughout the day. Actually, the example I gave, I think he was either 9 or 10, where he and his mom created a journal together and they would like swap the journal back and forth. And like, even if it's just small notes of like, I love you, I'm thinking of you, or if it's like updates about the day, like this cool thing happened at school, to create like a little bit of connection there. Maybe thinking about activities you can do while you're recovering from surgery so that he knows in advance. So again, like preparing him for, like, I'm going to have to rest a lot, I'm going to have pain, but here are some things that we can still do together or to stay connected. Because especially if he's not wanting to leave you, I hear a little bit of that like separation anxiety coming into play there. Most of the time, I don't know if you've talked with them about it, but are you planning to stay in the hospital for a few days? I do feel like most of the time it's pretty short. It's either outpatient or the home the next day.
Yeah, it can be anywhere from 1 to 3 nights in the hospital.
Okay.
And when I was first diagnosed with cancer, it was in the middle of COVID, so nobody could come
Mm,
visit me at the hospital at all.
right.
So he never saw me in the hospital. So it's like,
Yeah.
do I let him see me in the hospital? Is that just going to make things worse? Or do I leave it up to him? And it's like all these things are like going through my head, and I don't know
Yeah.
really what
I
to
you
do.
can definitely ask him, but I would say yes. I would say either FaceTime or have him come visit you because a lot of times, especially separation anxiety, is he just wants to know you're okay. So if he can see that you're in a room, like it kind of looks like a hotel for the most part. Like it's a nice room, there's a nice doctor, there's a nice nurse. Like if he sees that you're being taken care of and where you are, a lot of times that's really helpful for kids. I'm happy to, if we want to connect and we can, talk out a little bit more. I see
Yeah,
Andrea has her hand up too, but if you have any other specific questions, I can make sure you have my email.
thank you. Yeah, that
Yeah,
would be great. Thank you so
great.
much.
Andrea,
Well,
yes.
yeah, it's not a question. It's similar to what Elise said. When I was diagnosed, which was a long time ago, I had a 5 and a 7-year-old, and I went with my gut and uh, with I call her my den mother, Arden, helped me with this, but. The younger child was a lot easier. The older child at 7, 8 was reading college books, and
Wow.
which is a little Alex has always been scary. And during cancer, Alex was a little bitch and very scary. Um, and I've told stories about Alex, but the one I just want to tell you is that when I decided to take the wig off, when my hair was growing in, I was very worried about that. And exactly what Elise said, it was simple. It happened. I was washing my hands at the sink. The little one, 5.5, came into the kitchen. I said to him, please wash your hands. I'll give you a snack. And he saw me at the sink, and I looked like Annie Lennox, the jazz singer, short hair. I always had little earrings and lipstick on, and I could feel him staring at my head. And he said to me, Mommy, yeah, why did you do that to your hair? Because he didn't understand what a wig was. And I said, it was really itchy. And so um, I cut it off. And he went, okay, what snack are you going to give me? And that was it. Um, you give him an answer that it was true. It was itchy, and I took it off. And they have enough wherewithal to ask a question, and they're not necessarily interested in the answer, but the next thing was, I'm hungry. Can you, feed me? And he wanted to feel the top of my head. And he goes, boy, that feels funny. And that was that. But the older one, when I went in the hospital a couple of years later, and I miss Christmas. I'm Catholic, and I miss Christmas, and I never miss Christmas. But I was in the hospital over that period, and I the day after I came home, and I snuck into my older child's bedroom, and I didn't know what I was going to get, but I bent over and I kissed them, and I said, Alex, I'm sorry I miss Christmas. Excuse me.
Yes,
And
okay.
Alex said to me, Mommy, today is Christmas, you're home.
Oh,
So it
it's
still
beautiful.
gets me. And so
Yeah, it's beautiful.
the one who was a little bitch
Hmm.
had her moments. So
That's beautiful. Thank you for sharing. Yeah, and honestly, that really highlights what I try to always emphasize is how resilient kids are. They they create again, we see this like beautiful imagination they have, which sometimes can cause anxiety. But they're also just kind of fresh and new and resilient. And a lot of what they learn from it comes from us, comes from their caregivers, comes from people around them. And I think that's also just a testament to your connection with them and how, you are Christmas and you're home and that's what they've learned from you. And so I think that's just really beautiful. Thank you for sharing.
I think that might be the perfect place for us to stop. Catherine, this was incredible. Thank you so much. There's a wealth of knowledge. And everyone, thank you for joining.
Yeah, thank you for
Uh,
joining everyone.
our February calendar will be emailed out over the weekend. I'm just formatting it. But next Wednesday, we'll have our general group. And again, Catherine, thank you so, so much.